all. This is Dr. Mubin Sayed from Drbeen.com. Welcome to one more show. So let's look at the study today. It is an interesting study. It is from Yale. It is a preprint yet, but is a very important study. So post-vaccination syndrome, a descriptive analysis of reported symptoms and patient experience after COVID-19 immunization. So I'm going to start from the conclusion, and then I'm going to go through the study. So the conclusion is, in this study, individuals who reported post-vaccination syndrome, which we usually call vaccine injury, but they're not calling it vaccine injury because that implies causality. This study does not show causality, it just shows an association. So post-vaccine syndrome. And syndrome, because it is not one disease, it's a combination of many diseases and many kind of symptoms, so syndrome. So in this study, individuals who reported post-vaccine syndrome after COVID-19 vaccination had low health status, high symptoms burden, and high psychological stress despite trying many treatments. That actually says it all. And it is not going to be a surprise for many, because as much as this all is attacked, these kind of messages or this kind of this illness is ignored, still I believe a lot of our society actually knows that this is happening. So before we continue, I want to quickly give you an idea of what it is. This is a preprint. That means it is still to be reviewed and to be published and accepted for publication, and it may not be. However, it is from very good schools. So it is Harlan and Jilin Wu. I hope I'm pronouncing their name correctly. They are the lead co-authors or first authors. They are from Yale, and they are part of the Yale Dissent study. So here, Yale School of Medicine, Yale College, Yale School of Medicine, Yale School of Medicine, Yale, then University of Toronto, the College of the University of Chicago, Yale School of Medicine, Purdue University, Yale, and so on. You would actually see here Denise Hertz, Brian Dressen, who have been on this channel before. So if you see here, this is Bree's interview, and you may have actually watched her. If not, I have the link in the description. Please make sure that you watch her. She is, I believe, heading the React 19 or is in a leading role here. She herself is vaccine injured. If you look at the study, you would actually see her sitting here with a IV for her arm that she showed at some point. Anyway, so this is Bree, and she's part of the study. This is Denise Hertz. She herself is also injured. She is an MD. I have her interview over here as well. And then I'm sure that you remember Sean. Sean is still struggling through the vaccine injury. He is actually a nurse practitioner in the neurology department, so he is very well aware of how the neurological symptoms occur, what happens, and he himself is actually going through those for years now. So this is the first interview I had done with him. There are 1.2 million views, and this was somewhere, I don't know when, but it says so 2 years ago. Then we had a follow-up, and then we had another follow-up. So these are the references. All of them are present in the description of this video. In addition to that, you have the references. You have the links for Drbeen.com as well. And there is a very good link to give you access to Drbeen.com at a very, very low price. Don't miss it. So if you see here, the prices are actually higher, but you would see it for $67 only. So, okay, don't tell anyone. Let's start the study. So I'm going to go through the study in two phases. One, I want to present to you what the study's summary says. Then we'll go over some of the details. So a chronic post-vaccination syndrome after COVID-19 vaccination has been reported but has yet to be well characterized. Do you sometimes feel that why do we still do not know what is the percentage of injured, or what are the characterizations of these post-vaccine syndromes or vaccine injuries? Or why is there no fund to help these patients and they have to figure it out by themselves and make organizations and get donations and help each other? Because if there are studies that are going to tell what is the percentage of the people who are getting vaccine injured, then the term rare or very rare will go away. So that's never going to happen. And the where's like things are just, you can easily doubt them and say, well, that data is not reliable. So it just blows my mind that this simple thing to do, to follow up with the vaccinated individuals to see if they have a vaccine injury or possibility of a vaccine injury, it's not done for numbers. So anyways, a chronic post-vaccination syndrome after COVID-19 vaccination has been reported but has yet to be well characterized. My apologies, one more interjection. I was looking at somebody's comment on Twitter. Twitter is an interesting place where they were saying, well, this is a preprint. I have written a preprint as well. Anybody could write a preprint. Yes, you could write a preprint. I could write a preprint. It would never get published, let's say, if we have made some BS in there. We are talking about a study coming from the authors who are part of Yale and Toronto School of Medicine and Purdue University and University of Chicago. They are not just going to put some BS study to say, hey, look, we have our preprint out there. So somebody from their home posting a BS study to prove that you can have a preprint and something coming from Yale has a huge amount of difference in their credibility and gravitas. So let's keep that in our mind. Methods. We included 241 individuals aged 18 and older who self-reported PVS after COVID-19 vaccination. So here is another limitation of the study. This is a self-reporting study. And the study is for the people who had the vaccine and then they started developing symptoms within 1 to 3 days and onwards for a couple of years. So it could be incorrect, attribution to say this may be something to do with the vaccine. So that's why they're saying this is post-vaccine, after the vaccine. They're not saying caused by the vaccine. So that is still a limitation. It is a self-reporting study. And they talk about their limitations, that this is another limitation, that this study could only have people who were able to get this access, who were able to go online, who were able to go and do the self-reporting, who were healthy enough, relatively healthy enough to be able to do the self-reporting. There may be actually more injured that are not even able to get to the study and provide their results, or those who didn't have access to internet or access to computers. So there is a bunch of people who may not be part of this group. So this group's analysis that you're going to see is not the complete analysis. It is just a small slivers analysis. We included 241 individuals aged 18 and older who self-reported PVS after COVID-19 vaccination and who joined the online Yale Listen to Immune Symptom and Treatment Experience Now or Listen study from May 2022 to July 2023. So what they did was they took their demographics, their health status, their symptoms, their treatment stride, and overall experience. And look at the results. The median age of participants was 46 years. 38 to 56 was IQR, with 192 or 80% identifying as females. I know somebody's going to write a comment here that you've gone woke, identifying as female. That is what is written here. So I don't want to editorialize what is here. Identifying as women, 80%. 209 or 87% as non-Hispanic white. 88% from the US. Among these participants with PVS, 55% had received Pfizer-BioNTech, 86 or 37% received Moderna. The median time, look at the time, the median time from the day of index vaccination to symptom onset was 3 days, 1 to 8 days is when it is starting. The time from vaccination to symptom survey completion was 595 days, and IQR is 417 to 661 days. This should worry us. These patients are suffering for about more than 1.5 years, about 2 years. The median Eurocall visual analog scale score was 50. The five most common, so check out the symptoms. The 5 most common symptoms were exercise intolerance. Because of this, and people stop doing exercises. Excessive fatigue, numbness, brain fog, and neuropathy. Think about it for a second. Somebody who was healthy, happy, going about their normal life, did the right thing, were a good citizen, said, you know what, they are saying we should have a vaccine. I had the vaccine. And then cannot exercise anymore. Excessive fatigue, numbness, brain fog, neuropathies. I remember when I had COVID, and during COVID, I could not walk correctly. I could not get up from my bed correctly. And I thought the depression that I got, that is this what has happened to me permanently? Is this what's going to happen? Where is my life, normal life gone? So thank God I recovered, but there are people here who have not recovered. In the week before survey completion, participants reported feeling unease, 93%, fearfulness, 82%, overwhelmed by worries, 81%. A normal, healthy person going about their life, they become excessively fatigued. They start developing brain fog. Of course, they would have worries. They would have fear. They would have fear for their life, their career, their well-being, their financial aspects. Overwhelmed by worries, as well as feelings of helplessness, anxiety, depression, hopelessness, worthlessness, at least once. Of course, those patients who have committed suicide, they could not participate in this survey. That needs to be a separate study to see how many have actually died out of these psychological states. So conclusion, in the study, individuals who reported PVS after COVID-19 vaccination had low health status, high symptoms burden, and high psychological stress despite trying many treatments. So this is it. This is the study and its summary. Now I'm going to go over the PDF of this and go through some more details. So if you just wanted to hear that there is a study, I believe that this is one more study after the NIND study about neurological symptoms on 22 patients. One of those patients I had interviewed as well. This is another study that is here in a preprint. So let's see their PDF. So I've highlighted some important topics. Of course, everything is important. So this part I did not highlight. I've already discussed it with you, read it to you. Now, introduction, the vaccine against SARS-CoV-2 has saved many lives, but adverse events have been reported. The Center for Disease Control and Prevention notes the possibility of rare complications including anaphylaxis, thrombosis, thrombocytopenia syndrome after viral vector vaccines, Guillain-Barré syndrome specifically after viral vector vaccines, and myocarditis and pericarditis. These complications were not reported in the vaccine clinical trials, emphasizing the limitations of these studies in capturing rare adverse events and highlighting the critical role of post-market surveillance. I will keep telling you that how disappointed I am after 3 years that they actually have not been able to convert the term rare to a percentage to say 1% or 2% or 10% or 0.1%. A less well-characterized adverse event is a chronic syndrome with symptoms that begin soon after vaccination. A recent preprint from the US National Institute of Health described 23 people who reported neuropathic symptoms starting within 20 days after vaccination. The cause of this syndrome is undefined. Diagnostic tests and evidence-based interventions are lacking, and its connection with vaccinations remain controversial. And I can tell you that the healthcare leaders are happy with this staying controversial because they can just simply say whoever is vaccinated and injured, that's a conspiracy theorist. Whoever talks about them are anti-vaxxers. And all of a sudden things become fine for them. This is medicine. Vaccines are medicines. And in medicine, when we study medicine, we look at a drug and we say, here are the benefits of this drug. Here are the indication, that is when and whom to give. And here are the side effects of this drug. Here are the toxicities of this drug. And here is what you do when there are side effects or toxicities. This is all part of pharmacology of a molecule. This is, for me, it is surprising that just in the case of these vaccines, there are just such intense emotions for not recognizing that there are vaccine injuries. These folks have to actually defend themselves as well for being called names. Okay, so a first step in understanding what these patients experience is a description of their symptoms, treatment, and health status. We sought to describe the characteristics, symptoms, health status, treatment, and experience of individuals who report post-vaccination syndrome using data from the Yale Listen to Immune Symptom and Treatment Experience Now. So one more quick note over here. I recently get a lot of comments that you don't talk about vaccines benefits and you talk about vaccine injuries. Go back to my 2020-21 videos where, and they also criticize me for saying I have never talked about COVID's dangers. And I think the majority of my videos are about the cytokine storms and about how ACE1 and ACE2 imbalance causes the inflammatory state, which causes the whole body to become affected and even people dying. I have covered them all. It's not necessary that when a new study comes in about a vaccine injury, because it's a natural phase of this drug, that there was a disease, we talked about it. Disease had its harms, we talked about that. Then the solution started coming up, we talked about them. I have covered every single vaccine debriefing and vaccine trial in detail. Then came the protection, and we talked about it so many times about efficacies and the decline of efficacy and the protection from dying or protection from disease. And then came the injury time as well, the side effects time. And we are talking about that too. I am very, very comfortable that on this channel, you have the complete phase of a drug that you can see without any bias to say only for anti-vaccine folks or only for pro-vaccine folks. Although this happens at any time I look at a study that is about the vaccine's problems, I'm called anti-vaxxer. And anytime I present something that is, here are the benefits or indications of the vaccines, I'm called a vaccine pusher. So this I cannot win, but let's continue here. So LISTEN is a cross-sectional study. So LISTEN participants were recruited from Hugo Health Kindred and online patient community. The LISTEN study began recruiting participants who reported PVS in May 2022. PVS was defined by self-reports in response to whether the individual thought the vaccine had injured them. So this is a subjective and non-causative report, and it is self-reported. And they mention it in their limitations. Study sample. The study sample, 18 years, as we said before. And then let's continue. This is how they did the statistics. 241 individuals, self-reporting. Then here, regarding social support. These are very important paragraphs. Regarding social support, 41% had two or fewer supportive individuals to rely on for help. Getting help from neighbors was described as challenging or very challenging by 36%. Imagine this. Getting help from neighbors. While 10% rarely or never had assistance for tasks like shopping or visiting the doctor. Loneliness was prevalent. I know a patient, this is an anecdote, not the study. I know a patient whose close relative is an FDA, and they don't talk with her because they don't agree that she has a vaccine injury. So loneliness was prevalent, with 20% often feeling a lack of companionship, 23% feeling left out, 32% feeling isolated. Furthermore, 12% often or always felt lonely. Concern related to living situation and food security were also prominent. Living situation and food security. At least in this country, US, healthy ones are also always concerned about the shelter and food. And then you have a patient who has excessive fatigue and brain fog and neurological symptoms, pins and tingling and pains and such disabilities. Of course, they're going to be concerned about living situation and food security. Among all participants, 9% feared running out of food before they could afford to buy more, and 7% had stable housing but expressed worry about future loss. Transportation issues impeded 5% participants from carrying out essential non-medical tasks and 4% from attending medical appointments. Timing of symptoms onset. Symptoms began after the first, second, third, and fourth or more vaccination. So after the first dose, 44% people. Second dose, 33%. Third dose, 44%, and fourth dose, 9%. What that is saying is that a smaller percentage, the people who got first, second, third dose, for example, and didn't have a problem, a smaller percentage still have a chance to get injured. But a larger percentage after the first dose or the second dose. I've already talked about the health status. Symptom severity. So when asked to quantify symptom severity on their worst days, 0 representing a trivial illness and 100 for an unbearable condition, Participants reported a median severity of 80. New diagnosis since the pandemic. The most common new diagnoses in the study sample since the beginning of the pandemic were anxiety, neurological conditions, GIT issues, and postural orthostatic tachycardia syndrome. It's a painful study to discuss. Treatment. Participants reported having taken many treatments. The total number of unique treatments types was 209. 209 treatment types, which were grouped into 40 categories. The median number of individual treatments tried was 20. People tried 20 things to see if I can get better, at least. So 13 to 30 is the range. The most common prescription therapies reported were oral steroids, gabapentin, low-dose naltrexone, which I think works very well, ivermectin, propranolol for the heart conditions, and bronchodilators. More than 500 additional treatments were reported by participants. The most common non-pharmacological treatment included limiting exercise or exertion by 51%, quitting alcohol or caffeine 44%, hydration and increasing salt intake 44%, and intermittent fasting 39%. So then they go on a discussion. I think we have done that discussion. I would request you to see the link in the description and then read it for yourself as well. So this is a study I wanted to do an out-of-turn talk today and present this to you. Please have a nice day. Like, subscribe, and share. There are links in the description if you would like to support this work. And there are links in the description of interviews with Sean, with Denise, with Bree. Also, make sure that you check out the React 19's site. That is this, React 19. What I like about React 19 is that as much as they are helping and trying to uncover and present the vaccine injury, they are very scientific oriented as well. You will not find vaccine conspiracies here. You will actually find that they're looking for, they're advocating for the patients, and they're looking for the reasons for the patients. They're doing their own surveys. They're participating in studies, as you're seeing over here. So I really love it that they are scientific in their approach. And that is why, of course, I love their work as well. I respect them too, that because many of them are actually vaccine injured. So with this, thank you very much. Have a nice day, and I'll talk to you later.